Hello dear friends, you are welcome to SSB Pharma Learning Channel. I Dr. Shamsher Singh today going to discuss with you about the next GPAT question series part 23. In this GPAT series, as in continuation, I will discuss the recent concepts as well as some improved tricks with you so that which will be very useful for attempting the GPAT examination. So let's going to the first trick. The trick one is acid resistant penicillins. So that means the penicillin which are resistant to acid. You can remember by this name vodka for PM. So it means vodka for PM. V indicate penicillin, V, O indicate oxacillin, D indicate dicloxacillin, K indicate cloxacillin, A indicate amoxicillin and ampicillin, F indicate flucloxacillin, P indicate propacillin and M indicate methicillin. So it is very easy that you can remember all these drugs which are resistant to acid for the penicillin, that means the antimicrobial agent which are effective for gram positive and gram negative microorganisms, and you can remember by this code word vodka for PM. So you are welcome to SSB Pharma Learning Channel. The next question is, following is a Gaba A agonist. The options are mucimol, baclofen, bicuculin, and none of the above. So very fast you can comment or choose the right answer for this. The right option for this question is mucimol. So as I have discussed with you that GABA A receptor is a ion gated receptor, also called as a ligand gated receptor, and the GABA A agonists are used for the treatment of stroke as well as some other CNS related problem. So in case of stroke, in the various animal model, it has been used that mucimol act as a GABA A agonist, thereby open the chloride channel and responsible for the relaxation or hyperpolarization. So this is the right answer for this question. The next question is, quinidine is contraindicated in, the options are atrial flutter, atrial fibrillation, PSVT, that is proximal supraventricular tachycardia, and dioxin toxicity. So you choose the right answer for the quinidine, that where it is contraindicated. The right answer for this is dioxin toxicity. So as you know that quinidine which is not given with digoxin because it inhibits P-glycoprotein. The question can be in the GPAT that quinidine inhibit P-glycoproteins. So that means whenever the quinidine inhibit P-glycoprotein, it increase the plasma concentration of digoxin. The second thing is digoxin concentration in the plasma is increased. The third thing is it reduces the glomerular filtration of digoxin. That means it reduces the elimination of digoxin from the body. So there are three mechanisms that how quinidine act to produce toxic effect of digoxin. First, inhibit PGP. Second, increase plasma concentration. Third, decrease glomerular filtration of the digoxin from the body. It means reduce elimination rate of the digoxin. So that's why this is the right option for this question. Next question is, which of the following drugs should not be used in glaucoma? So the options are acetazolamide, pilocarpine, steroids, and mannitol. So you can choose the right answer for this, that drug should not be preferred in glaucoma. The right option is steroids. So basically you know that steroids, they are not preferred in glaucoma because the reason is they increase the intraocular tension. How? By increasing the sodium retention and water retention. So in case of glaucoma, this type of steroids are not preferred because they ultimately can cause glaucoma. So steroid is the right answer for this question. Next question is, schizophrenia has following clinical features. The option for this question are delusions, hallucinations, trouble concentration, and all of the above. So you choose the right answer, that schizophrenia produce which type of clinical features or the symptoms. The right answer for this question is all of the above. So it means schizophrenia, which is a CNS related disorder affecting both male and female, and exist along with bipolar disorder. So that means the patient who are suffering from the bipolar disorder, they also having a chances that they will suffer from schizophrenia. So this can be another question in the GPAT. And the third thing, it produce three type of the symptoms. The symptoms are CNS related problems, hallucination, that is false belief. The third is delusions and trouble concentration. So it affects the concentration of the person, reduce the concentration, reduce the memory, and it is possibly caused by stress. It can be caused by any kind of fear, or it can be caused by divorce like condition, or whenever there is a death of any person to whom the person has a love. So that means these are the factors which are responsible for the schizophrenia. So that's why you know all of the things, they are right. This is the right answer. The autonomic nervous system is also known as, options are visceral, vegetative, involuntary, all of the above. You comment or the choose the right option for this question. Autonomic nervous system, ANS. The right answer is involuntary nervous system. Now you know that involuntary nervous system or involuntary thing is responsible that is not under your willing. So what are the things which are involuntary? Like breathe. So whenever you go for sleep, your breath is not stopped. So this is an involuntary thing. The second thing, respiration. The third thing, digestion of food. Fourth thing, movement of blood. So that means the muscles which are involved here, they are called as involuntary muscles. The question in the GPAT can be, smooth muscles and the cardiac muscles are called as involuntary muscles. And on the opposite side, skeletal muscles are called as voluntary muscles. So that means this is the right answer, that involuntary system, the system which is not under your control, so is called as a autonomic nervous system. So this is the next new trick, anti-pseudomonal penicillin, the penicillin which destroy the pseudomonas. So you can remember by this name impact. So what impact mean? I mean imipinam, M mean mesloxilin, P mean piperacillin, A's mean azeloxylin, C mean carbencillin, and T mean ticarcillin. So you can remember this, all of the penicillin derivatives or the drugs which destroy the pseudomonal bacteria or the infection caused by the pseudomonas. So you can remember it by the short trick, that is impact. So this is a new trick which will be very useful for you all. The next question is, pseudocholinesterase is present in. Options are membrane, vesicles, synaptic cleft, plasma and tissue. You choose the right answer, pseudocholinesterase. So the right answer is plasma and tissue. So I will discuss with you. The first thing is cholinesterase. The option can be in the GPAT. Cholinesterase degrade. Which one? Acetylcholine, or they can be adrenaline, they can be isoprenaline, they can be dopamine. So the right option is cholinesterase degrade acetylcholine, the first thing. So there are two type of cholinesterase. One is called as a true, another is called as a false or pseudo. So true cholinesterase are called as a acetylcholinesterase, and false pseudo are called as butylcholinesterase. So butylcholinesterase, they degrade acetylcholine in plasma and tissue, whereas acetylcholinesterase degrade acetylcholine in the CNS. So that's why anticholinesterase drugs which are used to prevent the acetylcholine degradation are useful for the treatment of dementia, are useful for the treatment of Alzheimer's disease and cognitive problems. So that's why you can remember this thing, that pseudocholinesterase, they are present in plasma and tissue, and the true cholinesterase, acetylcholinesterase, are present in the CNS. So this is the right option for this question. Next question is, what are the initial sign and symptom of hemorrhoids? So this is like a pile, it affect to the number of population. The options are bleeding and pain and redness, seepage and pruritus. So you choose the right answer, that which one is the initial symptom. The initial symptom for the hemorrhoids is which one? So the initial symptom is, the right option is bleeding and pain. So bleeding and pain is the initial symptom of these hemorrhoids, and which affect the lower GIT tract, and there is a swelling of the area that is lied around the anal aperture. So this is the right answer for this question. Next question is, the glucocorticoid described as highly potent anti-inflammatory agent is. Options are methylprednisolone, cortisone, triamcinolone, and next is dexamethasone. You choose the right answer, which one is a highly potent. The right option is dexamethasone. So you always remember that dexamethasone is more potent than deflazacort, and deflazacort is more potent than methylprednisolone, and methylprednisolone is more potent than prednisolone, and prednisolone more than cortisones. So you always remember this serial order, so that it will be very useful in the GPAT. That dexamethasone at a low dose is, suppose I will tell you, deflazacort at a dose of 10 mg or 20 mg, here is equal to 0.5 to 1 mg, and this is methylprednisolone equal to 2 mg, likely that. So dexamethasone is more potent than deflazacort, then methylprednisolone, then prednisolone, like that. So how they are anti-inflammatory? Because you know that dexamethasone inhibit the COX-1 dependent secretion of inflammatory mediators. The first thing. The second option can be dexamethasone reduce and decrease the activation of T cells. So this is also reported in the research that dexamethasone reduce the synthesis of pro-inflammatory mediator like interleukins, TNF alpha like that. And the second is, as reported in the research, dexamethasone reduce T cell activation. That's why these type of the steroid, they are preferred for the inflammation of joint or inflammation of tissue or any other part of the body. So this is the right answer for this question. The next question is, following 5-HT receptor is a ligand gated ion channel. Options are 5-HT1A, 5-HT2A, 5-HT4, 5-HT3. So you choose the right answer. Which one is a ion gated? That means ligand gated, not a GPCR. So you check which one is a ion gated 5-hydroxytryptamine receptor. Right option is 5-HT3 receptor. Now how 5-HT3? Because 5-HT3 receptors are present in the GIT tract, and the drug which act on the 5-HT receptors are ondansetron and granisetron, which are antiemetics. So basically the question could be in the GPAT, which 5-HT3 receptor blocker or which drug act on the 5-HT3 receptor is useful to prevent the chemotherapy induced vomiting. The answer will be ondansetron and granisetron. So those patients who suffer from chemotherapy, cisplatin or some other drug related emesis, these emesis can only be prevented by these type of drug which act on the 5-HT3 receptor, and 5-HT3 receptor act by activation of sodium, potassium and calcium. So 5-HT3 receptor is the right answer for this question, ligand gated ion channel. So there is a next question, phenylephrine causes. Options are constriction of vessels in the nasal mucosa, increased gastric secretion and motility, increased skin temperature and meiosis. You choose the right answer, phenylephrine. So phenylephrine, the right answer is constriction of the vessels in the nasal mucosa. So you know that this drug phenylephrine cause, this is a rebound type of the nasal congestion. So this is the side effect of this drug. Whenever a patient stops to take phenylephrine, again there is a rebound nasal congestion which occur with the phenylephrine, and many a times there is a dryness of mucosa of nose. So this drug also causes dryness of the mucosa of nose. So that's why the chances of the congestion are, constriction or the congestion are more. So this is the right answer. So this is the next trick which is very easy to remember, extended spectrum penicillins. So how you can remember this? Cat map. So suppose you can remember this is a cat and you look for the map of the cat, where the cat goes. So you remember it by cat, C indicate carbenicillin, T indicate tricarcillin, A indicate ampicillin and amoxicillin. So A, ampicillin, amoxicillin are aminopenicillin, and carbenicillin and tricarcillin. Tricarcillin is a carboxypenicillin due to presence of carboxy group in the structure, here presence of amino group in the structure, and MAP mean mesloxylin, azoxystrobin and piperacillin. This is a uridopenicillin. So you can remember extended spectrum penicillin. You easily can remember by cat map. So this is the new trick which is very useful for you all. So this was the last trick I have discussed with you. Hope this all the sessions, all the questions with the basic knowledge are very useful. You always like, watch and subscribe SSB Pharma Learning channel, and in the coming time I will discuss with you more videos with more basic concept, and that will be more useful for you all. Thank you very much. Welcome.